Doc.
Great conversations and education on relevant health issues management. Hello, Doc.
Hello, Doc.
Make a date with our health professionals on the drive with the area gang. Mondays 2:45 to 3 p.m. Hello, Doc. Hello, Doc.
Hello, Doc.
Hello, Doc.
Hi.
Welcome. How you doing?
Good, by God's grace.
All right. It's great to see you here and see that you've got your smile on.
Good to see you wearing glasses today.
Oh, yeah. I've been wearing it, but I keep hiding it. But they say I should wear it, so I wear it.
I was going to advise you to wear glasses. So.
Yeah. I don't know. I'm still struggling to keep it on. So I usually will wear it when I have to read small fonts, and then I'm sometimes I will struggle. And then, especially on my phone, I'm not able to read that much on my phone. But the thing is that I'm struggling to read. I'm like, what's wrong with you? But I'll try. It's a lifestyle adjustment that I'm finding it difficult to do, but I'll try. I'll keep. When we were young, we used to fancy people who wear lenses, like it's like the DBs who would be wearing,
Yeah.
But as you age, you don't have a choice. Anyways, we're talking about the eye this month, so I need to comply. Last week we looked at cataract, right? Yeah. And what I remember was you saying that it actually affects the lens.
Yes.
Right. Today we'll look at glaucoma. If you could start with, last week you started with
describing
the eye.
Structure of the eye.
Yeah. So if you could start with that again today, before we look at what glaucoma is and what parts of the eye it affects, I think it paints a good picture.
Okay.
Yeah.
So what I said last week was consider this like the size of a golf ball.
Yeah.
Okay, and you have a smaller circle over it, about 1.5 cm black circle. So that's like your iris.
Yeah.
Yes. So that's where the color of your eye is, and the rest is white. So that white outer layer is called the sclera.
Okay.
And then the black inside is called the iris. So over the iris is the conjunctiva. It's like a clear covering. Over the iris, the cornea. Then there's the conjunctiva that is on only the front parts of the eye.
Okay.
Yes, to prevent.
It doesn't
dust.
go all the way to the back.
The conjunctiva doesn't go all the way to the back.
Okay.
The cornea is the front part, and then the conjunctiva just from the eyelids to cover the front.
Okay.
So there's the space between the cornea and the iris. There's some fluid in there called the aqueous humor.
Okay.
Then behind the iris is the lens. Then behind the lens, the rest of the ball is there. That contains another fluid called the vitreous humor.
Okay.
Then the inner lining of the back of the eye is what we have the retina, where the light rays go and focus on, and they all point towards one place where the optic disc, which has the sensors for the optic nerve. So the nerve is what takes the information to the brain to translate what you are seeing with the light rays.
Okay.
Yeah.
So last week we learned that when there's a problem with the lens, that's cataract.
That's cataract.
Okay. What are we learning today about glaucoma?
Glaucoma today, the problem is with the optic nerve.
Okay.
Yes, and more of the retina, the back layer of the eye to the optic nerve. Yeah. So it's the second leading, after cataract, the second leading cause of blindness. And usually there are quite a number of different types of cataract, but the common ones we normally say are the open angle and then the closed angle. Okay. So usually there's a pressure that is maintained by the aqueous humor, like nourishes the organs of the eye. So it's being produced, and then there's a space in between the cornea and the iris where the fluid drains out of.
Okay.
So when that angle is either narrowed, that's open angle, or closed, that means it's completely blocked, closed angle.
Okay.
Yes, so in that case, the fluid doesn't have anywhere to go, but more fluid keeps being produced, and it increases the pressure.
Okay.
The pressure goes within the whole eyeball, and then now starts pressing on the nerves and the retina, and then causes the damage there. So it's like hypertension, but for the fluid in the eye.
So what happens is that you have the fluid coming in and it has to drain out.
Yes.
Okay. But then the opening for the drainage, sort of, is closing or is completely closed.
Yes.
So you don't have the fluid draining out, and it builds pressure in there and it presses on the nerve.
Yes.
Okay. I think it makes sense. So then that is glaucoma.
Yes, that's glaucoma.
All right. What would you be experiencing if you have glaucoma then?
Okay, you see, as I said, it's like hypertension. And hypertension, we know it doesn't really have any symptoms in the early stages. Okay, so we also call glaucoma the silent killer of vision. Okay, or it causes blindness very silently. So, because in the initial stages, there are no symptoms.
See anything.
You don't have any problems with your sight, or you don't notice any problems with your sight until there is irreversible damage that has been caused.
Okay.
That's when you start having the symptoms. So people might have blurred vision, double vision, and then they'll see that their vision is gradually going down. They're not seeing as well as they used to. Then sometimes they realize that they can't have enough peripheral vision. So they can see only straight forward. So if you're standing maybe to their right or to their left, they won't notice that you are standing there unless you come in front of them. So that's what we call the blind spots. So they develop blind spots, like wider blind spots. Yeah. So those are the normal symptoms that people present with, and usually by that time there's some damage already to the nerves.
So you're saying that in the initial stage you might not even have any symptom
at all.
But are there any warning signs or red flags that you should know? For which reason maybe you want to go to the hospital to have a test or whatever?
We have the emergency eye signs. That's when you are in danger, immediate danger of losing your eyesight. That usually happens in close angle glaucoma. So that's there is blood in front of your iris. So your iris is supposed to be black, then you are seeing red. Or you see in the person's iris red all around the edges. Sometimes there will be severe eye pain coupled with nausea and vomiting, or they'll be feeling a lot of pressure in the eye. Sometimes they will have this rainbow colored halo around light. So if they see a light, then they will be seeing rainbow colors around the lights. And then sometimes they'll have this sudden, like, floating items like in their line of vision, or they see like lightning flashes or flashes of light all of a sudden in their line of vision. That means the retina is being pulled very tightly, and if they don't get treatment immediately, they can go blind. Some people, they just lose their vision all at once.
But what are the tests that are used to diagnose glaucoma?
So testing the glaucoma is not that simple. We have a number of tests that we do. We do what we call tests to test the function of the eye, and then to test the structure of the eye. So normally when you go to the eye clinic, the eye test, you close one eye, A, B, C, D, those kind of things here. So that's the visual acuity. So you are just seeing how well you can focus your eyes on things. Then we do the visual field test. So we see if you can see things in your peripheral vision, if you can see like black and white, if you can see color in your peripheral vision. So that's for the function. So then the structural one, those who have been to the eye clinic, you know that thing that they tell you to put your chin
on it, and then you look through some lens.
Yes, the slit lamp. So it kind of has like a magnifying glass or a microscope. It's a very strong lens to really look inside. So that is what can be used to measure the pressure in your eye. It's used to measure the angle between your iris and the cornea, as I mentioned. It's used to measure the thickness of your cornea. It's used to also look into the eye to see the back. So that one, they dilate the pupil. They give you some eye drop. It opens up the pupil, and then they see the back. They see the retina. They see if the blood vessels are affected, and they see the optic disc. So they're able to assess the structures within the eye and see if there's any damage. So you need a combination of these two tests. You can't just do one without the other, because sometimes you might even have normal pressure glaucoma. So there's normal pressure in the eye, but
you still have glaucoma.
Yes.
Okay. But I was going to ask you though, would you need to do the specific test for glaucoma, or the normal? If you go for a normal eye test, would they be testing for glaucoma, or you actually need to specifically be testing for that?
you have to specifically test for glaucoma. So when you go for the eye screening, you tell them you want a full or comprehensive screening.
Okay.
And you tell them you want to rule out glaucoma. They will do that for you. Normally, what people do is just the functional test to see if they need glasses or not.
Yeah.
But when you add the other test to it, then it makes it complete to be able to be sure that every structure in the eye is also looking quite healthy.
Okay. I didn't ask you this though. What are the causes for glaucoma?
Yes. So as I mentioned, the cause is usually the increased pressure in the eye. But aside the pressure, aside what I mentioned about the angle and all that, there are some other things that can also cause an increased eye pressure. That's eye injuries, some kind of infections within the uvea. Okay, I didn't talk about uvea, but the under the sclera, all around, there's another layer. From the iris, that layer all around, that's the uvea. So sometimes if they have
UV,
it's uveitis. That's an inflammation of that layer.
Okay.
So with that, that can also cause that kind of pressure. That usually happens probably, I think, is it herpes simplex virus? Some viral infections, some parasitic infections as well can cause uveitis. Sometimes too, if there's a traumatic injury, you're in an accident, something hits your eye, that can also cause that as well. So that's really those are the most common causes. And then there are other times we don't really know the cause, but when you look in the eye, you see that there's damage to the retina and then the optic disc, so you can't really tell.
But is it hereditary though?
Yes, so those are the risk factors. So the risk factors, yes, if you have a first degree relative, that's mother, father, brother, sister, who has glaucoma, then you have a high chance of also developing glaucoma.
Okay.
Aside that, so the other risk factors are age. Above 40 years of age, your risk is increased.
This 40 years, as if we have a choice, we'll not clock 40.
Okay. Some people also say 55 years
Okay.
in US, so maybe you have more time. All right, so it's more also common in black people, especially the open angle glaucoma.
Wow.
Yeah, and then it occurs more in females than males because of female eye anatomy.
Wow, I actually know guys who have glaucoma. I don't think I know a female who has glaucoma.
Really?
I thought it was prevalent more in males than females.
It's actually more in females.
Okay.
All right. So then people who also have refractive errors, so nearsighted, farsighted, they are also at a higher risk. Nearsightedness are more likely to get open angle than the far-sighted people are more likely to get the closed angle glaucoma. And then people with chronic conditions, diabetes, hypertension, yes, it affects the blood vessels, which are also supplying the eyes as well. So it can also lead to glaucoma over there.
Okay. You mentioned that you can actually have glaucoma. You don't have symptoms, so it would take a longer period for you to even get to know that you have glaucoma. But once you have glaucoma, how quickly can it progress, and what are the factors that will contribute to its progression?
Okay, so with glaucoma, sometimes it can take like 10-15 years between the initial symptoms, like signs, and then total blindness.
Okay.
That's if you don't do anything about it. Yeah, but depending on the severity of the pressure in the eye, it can be faster. Or maybe the time that they diagnose it, or there's already a lot of damage by the time they diagnose. That means your time between then and total blindness is shorter. Also, if you have the risk factors, the chronic illnesses, and also I think increased age, yes.
Okay.
So the older you are as well, the faster the progression to total blindness.
Okay. Let's look at two things. First, we look at treatment. I was actually trying to do some reading on glaucoma before we came in, and I read that it's not treatable. You cannot treat it. Is that the case?
I don't want to use treat. Let's say the damage it causes is not reversible.
Okay.
Yes.
Okay.
If we notice it early, we can try and then mitigate it and prevent you from getting the total blindness. But once the damage has been caused, once those nerves have been affected,
You can't reverse it.
Reverse it. So if
Okay.
you've lost your peripheral vision, we can't bring back that vision.
Okay.
But we can work towards preventing it going into total blindness.
Okay. So what are the treatment options?
Okay, so normally we do the eye drops to reduce the eye pressure. Yeah, so most often that's what a lot of people do. Sometimes maybe they complain that maybe it stings their eye and all those things, but you have to talk to your doctor about it if you're uncomfortable. Maybe it makes your heart beat too fast and all those things. They'll teach you how to drop it so that it doesn't affect you that way, or they might change the medication for you. But if you are asthmatic, some of them may trigger some asthmatic attacks. So you have to let your doctor know that you're having asthma, so that they will not give you certain kinds of medication.
Okay.
Yeah. But aside the medication, we have the outpatient surgeries and then the more serious surgeries. So the outpatient ones are the laser surgeries. So there's 2 types of laser surgeries. There's the one that they use to just clear up the drainage system to make it flow better. That one, I think it may or may not work, and you may have to repeat it every 2 to 5 years or so.
Okay.
Then they have the laser surgery that they make a small hole underneath the cornea so that the fluid will be dripping through there instead. Then they have the actual surgeries they make an incision, create a flap, a way for the fluid to come out. And if that surgery doesn't work, then they would have to put in a glaucoma drainage device that will have to, it's like some small tubules to drain out the fluid from the eye to prevent the pressure.
Okay.
And then sometimes cataract surgery can help, especially if the lens is what is causing the angle to be pushed close. Sometimes the lens is pushing the iris forward. So once they replace the lens with an artificial lens, that also opens up the angle and it solves the problem. So you have to see a specialist to identify what the cause is specifically, and then they take it from there.
Okay, and the last thing I want to know about this is if there are any lifestyle changes that can actually help manage glaucoma.
Okay, so the checking your eye, doing comprehensive eye testing. So if you're under 40 years, once every 5 years, you can go and then ask for a comprehensive eye test for them to check everything, all the function and the structures of the eye. If you're above 40, then maybe every 2 to 4 years, then you have to be checking. But once you are 55, that means at least every year or every 2 years. But from age 65 onwards, at least once a year, you have to go and be checked, especially those who have diabetes and hypertension. That one, I think it's even if you're like 40 years and above, you have to be doing it yearly to be sure. You have to invest in eyewear. Okay, even if you don't have the refractory errors, you can be wearing sunglasses to prevent strain from the rays. I think even the laptops that we've been using and the phones that we've been using, they can be quite bright.
Yeah.
So you have to
Reduce
adjust the settings,
yeah.
the light settings, yes. And then if you are working in a place where there are flying debris, or you are working with any drilling and all those things, you have to wear the eye goggles, protect your eyes from damage. Stop smoking as usual. And
Stop smoking.
and too much caffeine does not help. Caffeine has been noticed to also increase the eye pressure a bit. So
Okay.
don't drink. You can drink some, but if you drink
Don't
too
drink
much,
too much.
yeah, it can also worry you. Then you also monitor your illness. If it's diabetes, hypertension, do your checkups, take your medications, healthy living, healthy eating, exercise, weight control, those kind of things. Yeah.
Okay. Thanks for the education. I don't know. This year I probably will have to do the comprehensive.
Yes, please. We do it
check
at
for-
our hospital. We have an ophthalmologist at Wijapa
okay.
Municipal Hospital.
Okay. I'll
So-
contact you for that, because sometimes it gets scary when we're looking at this. Anyway, but thank you very much, Doc, for coming on. I think we'll conclude on the eye infections next week.
Yes.
So please, it's very important. The eye is a very delicate organ, right?
It is,
And
it is.
you want to protect it for as long as you know. You never know. Some of us will live long. We live to be very old men and women.
Yeah.
And so you want to take very good care of your eyes so that you still have good eyesight even in your old age. Thank you very much, Doc, for coming on the show this afternoon. That was Dr. Emefa Dzide from the